Living with chronic pain can affect more than just how you feel physically. It can stop you from working, spending time with family, and doing other things you enjoy. If you already tried things like physical therapy, injections, or medication without lasting relief, our next guest says they have more options. At Minivasive Pain Orthopedics, they help patients get to the source of their pain. Dr. Nguyen explains how advanced minimally invasive procedures can provide long-lasting relief. Dr. Nguyen, let's first define what chronic pain is. This is not like I have a bad headache because I drank too much last night.
Yeah. So there's different definitions for chronic pain. Some say it's 4 weeks, some say it's 3 months or 6 months. I think of it as when the pain starts changing the patient. They start compensating for their pain or having psych issues or things like that that can be debilitating for them.
Yeah, and it just basically dominates their every waking thought.
That's correct. They'll lose sleep. They'll take medications that just can be agitated throughout their life.
Yeah, there's not one way to deal with it, and that Minivasive Pain and Orthopedics, that's one thing that you all realize. It can be as different as your patients are.
That's correct, yes.
So explain to me how y'all do things here, and of course we have pain, but we have orthopedics mixed with it. Sometimes they kind of act with each other, don't they?
Minivasive Pain is a multi-specialty organization. We have multiple different specialties inside the group, including pain physicians like myself, orthopedics, neurosurgeons, and even podiatry under one roof.
Yeah, oftentimes we'll come in as patients and say, I don't care what you do, just get rid of the symptom. If you just get rid of the symptom, that's just maintaining something. You want to reduce or eliminate the actual source of the pain.
Yes, that's true. I don't want to just mask their pain with medications or things like that. We actually have more advanced procedures and surgeries now that we can cure their pain.
Yeah. What got you interested in this part of medicine?
Of course, physicians, our duty is to treat the disease and help the patient get out of suffering. I chose interventional pain medicine because that gives me the tools that I can best accomplish that goal.
Yeah, and actually change someone's life, like Lisa. Let's listen to what she had to say.
It was difficult to walk around the block. My neck would hurt, and I had headaches all the time. Dr. Nguyen really helps diagnose your pain right away. He really wants you to help avoid surgery if possible. Now I'm pain-free.
And unless you've gone through that, those are really powerful words that she just said. A lot of times we think the answer is simply a pill or a surgery, and she said she wanted to avoid surgery because surgery itself can cause some other issues.
It can. There's always risk with surgeries. Like that's true for any type of invasive procedure. Scar
tissue, extra trauma to the body and the whole bit. And a lot of pain management physicians do focus on the injections or the medication management, but you look at a wider scope of things.
That's correct. I do things like pain stimulators like Lisa has. This uses low-level electricity to help eliminate the pain with an implantable device. There's also pain pumps that use medication infusions to help with the pain as well, and including minimally invasive decompressions and joint fusions.
Yeah, and we say minimally invasive is that you're not doing the cutting open or anything like that.
There is a scar, some as small as a quarter of an inch.
Minimal.
Yes,
yeah.
That's correct.
Yeah, all right. Who could benefit from seeing a specialist?
Anybody that's in pain can see a pain specialist. I'd say don't wait too long. The longer you wait with the pain, the more unnecessary suffering that you will have to endure.
Yeah, you treat all kinds of conditions, arthritis, which we know can be very painful, degenerative disc disease, herniated disc, and nerve compression. A lot of people have almost given up hope, but Daniel says when he first saw you, he came in and he wasn't sure, but now he is.
I was pretty bad when I first saw him. Barely could walk, had a cane, intense, throbbing, aching. If you're looking for a great staff, a great doctor, he explains everything to you. My mobility has gotten better and better all enjoyment of life, but it's been a blessing. It's been a blessing.
All right. What's the common mistake a lot of people make with chronic pain?
Again, I think the most common mistake is they think they can just get through the pain, live with the pain, work through it, just live their everyday life with it. The problem is it'll affect every aspect of their life, including their family life, their social life, job productivity, even their sleep. Simple things like that. There's not a good life to have.
Yeah, all right. They should schedule an evaluation, because even if they've been told nothing else more we can do, or even if they're using something else, like I mentioned, with medications, we know those can cause other issues as well. But if you're just using a medication but not getting to the root cause, schedule an evaluation. You want to take a closer look.
That's correct. We make it easy for patients. We do have 15 clinics across the greater Houston. All patients have to do is just give us a call, and we can get them into one of our clinics with one of our specialists, or even myself, within a week.
Yeah, all right. And you have a new Heights location, by the way.
That's correct. It is our. It just opened up a couple of weeks ago. It has all the specialists in-house, brand new facility, and we can get patients in pretty promptly.
Well, thank you very much for that. I know there are thousands of people who deal with pain and try to push through every day, and you're here to say you don't oftentimes have to push through it. We can get to a resolution and get you out of pain. Thank you very much.
Thank you. Glad to be here.
Minivasive Pain and Orthopedics has 14 locations in the greater Houston area. If you're suffering from pain, take the first step toward relief today by calling this number. It's 346-800-6001. Again, the number is 346-800-346-6001. Same week appointments are available. For more information, you can also visit their website at minivasivepain.com.